Hi there, and welcome to another edition of J-Talk Live. I'm here today with Dr. Laura Waltman, who is the Chief of Pediatrics here at Joseph Brant Hospital, and I'm your host, Ian Preyra. Our topic for today is, as we go into the fall season, what to do with all the respiratory illness, how to keep yourself safe, how to keep your family safe, and what to do if you become ill. So welcome, Laura, and let's get to it.
Thank you, Ian.
So when we talk about the respiratory illness season, what are we talking about? Like, what illnesses are these?
So we're talking about mostly viruses such as influenza and RSV, which is a respiratory virus that specifically affects children and young infants, disproportionately to yourself or myself and older adults.
It seems like so many people get so much sicker in the fall than they do in spring and summer. Is it just because people are more crowded together, more indoors?
Well, that's one factor, but the respiratory illnesses are easily spread through surfaces and runny noses. And for children who don't know how to properly wipe their noses or cover their coughs, it can spread more quickly throughout those environments.
Yeah, for sure. It seemed like whenever my kids started school, everyone would get sick, especially when they started daycare. It seemed like the house was runny noses for 5 years at a time.
Absolutely. So once we're exposed to some of these viruses, our bodies learn how to react to them and how to fight them off. But for children who haven't seen those viruses, their bodies don't know what to do, they can certainly present with more symptoms.
So you talked about RSV and you talked about influenza. I think those are the ones that people are pretty familiar with. And then, of course, COVID. Is there still COVID around there?
Absolutely. I mean, we've seen rates of COVID circulating even throughout the summer, and we anticipate that these levels will continue to spike and circulate throughout the fall and winter season.
So how do you know when your kid's sick? Like, how do you know when your kid's not just got a regular cold and they need to be seen by a doctor?
Yeah. So things that we look at would be fever lasting more than 4 or 5 days. It's important that you go see your doctor to see if there's anything else that could be developing or going on. If a child is having difficulty breathing, so really using a lot of effort to breathe, or if they are breathing really fast, or if they're, as I mentioned before, not able to drink or stay well hydrated, so not peeing or wetting their diapers as much, those are reasons to go and see a doctor. Your first step might just be your family doctor, but if the symptoms are more severe, you may end up presenting to the emergency department.
So if your kid's sick, how long do they have to stay home from school or from daycare?
Well, the public health, I'll refer to public health for the most up-to-date guidelines and certainly connecting with the school. But once you've had 24 hours with no fever and symptoms are generally getting better, your child is able to eat and has the energy to participate in their regular activities. In general, it is safe for them to go back to school.
Yeah, you know, I think there's kind of two schools of thought, right? Like back, I think when we were growing up, our parents would be like, yeah, just go get it, then you won't get it again. I don't know if that's really the case with things like RSV and influenza and some of these respiratory viruses. Can you get them again and again?
Yes, so each season there can be different strains. We've certainly seen that with the evolution of the COVID virus, and we know that that's the case with influenza as well.
Now, what about other folks in the house? Anything to be aware of? Like, I know many people live with grandparents or elderly members of the family or people who have chronic illnesses. What do you do with your kids if they're sick and you have those kind of folks in the house?
Well, one of the biggest challenges that I speak to parents and families about is you have a newborn infant at home and there are school-age children living in the same home, and a lot of parents are very worried about what that means for their newborn infant who doesn't have the same immune system as the parents or the other children. I think that we have to find a balance between protecting those who are most at risk. As you mentioned, infants are one of those, and elderly is certainly another population we have to think about. So when I speak with families, I tell them to ensure that they're making choices to the best of their ability not to expose young infants to acute illness. So other kids who are getting sick or other visitors, to be a little bit more protective. I also tell them to focus on areas away from the face or mouth. So play with their toes and try and do your best to minimize the spread of illness. But we do know that the viruses are going to spread, and we can't live in a bubble and prevent all exposure to viruses.
I think the other question I have for you is, when you talked a little bit about little babies, at what age does it start to become safer to have them around people?
So I think different people have different risk levels that they're comfortable with. In general, as physicians, we feel a little bit more comfortable with increased exposure once children start to get their immunizations. So generally around 2-3 months. At that time, we also can understand symptoms that they might be presenting with a little bit better. So more specific, if they have a runny nose, you know, okay, this is more likely to just be a cold as opposed to a serious or more significant illness.
So you mentioned their first immunizations, and maybe we should talk about that, because I think there's a lot of conflicting information out there, especially on social media. So immunizations, are they safe? What should parents get their kids immunized against? Is there anything that they should avoid, and when?
So Ontario has a routine immunization schedule, and many of these vaccines have been around for a very long time, and we have good data to suggest what are the potential side effects, and certainly we have seen the benefits of our standard routine immunization program. This is done through baby visits with your primary care physician, and the safety data is very good for those immunizations. There's too many to start listing them all off now. Specifically around this time of year, the immunizations that aren't part of the routine program, such as the influenza vaccine, are very important for families to consider, and children over the age of 6 months are eligible for this vaccination against influenza.
So one of the things that I've seen recently is RSV for newborns. I remember in Emerge seeing really sick newborns with RSV, and it's kind of cool that now at birth is it a vaccination or an immunization that you can give them?
So this is a brand new program, and Ontario is one of the provinces that is rolling out a universal immunization program against RSV for all infants born during that season. Given that this is the first season, there's some unique criteria that we're looking at, but it is a very exciting opportunity, given as what you've mentioned before, RSV can cause some infants and young children to become quite sick. So maybe I'll start speaking a little bit more about RSV, and then why the immunizations are helpful. So RSV in kids can present as a cold, but in younger infants tends to affect their lungs and cause difficulty breathing. For little kids who can't blow their nose, it can affect their feeding, and that's what we tend to see children being admitted to hospital. We've had RSV immunization before, and that's only been for the children at most risks, such as premature infants or those with congenital lung problems. So this year, the vaccine is going to be available for all infants born in hospital and all infants born since January 2024 up until now through their primary care physician's office.
Cool. And is this something that's relatively new?
So you asked before about whether it was a vaccine or what exactly it is. So the immunization is actually an antibody that is given as a medication through an injection that will help the baby fight off the virus.
So kind of like the antibodies that someone with a mature immune system would make naturally, but babies are too young to make?
Exactly. So usually in order to make an antibody, your body has to see the virus. But in this situation, we'd be giving that antibody to help fight off the infection without having been exposed to the virus.
And is that safe for babies?
So there have been studies that have shown that this is a safe medication for infants and can reduce the rate of presentation to the emergency department or admission by as high as 80% and reduce the admission to the intensive care unit by 90%.
And I think you said earlier that most of the infections are viral, not bacterial?
So many of the infections right now that we would see are viral. Sometimes what happens is when your body is fighting off a virus, your immune system is busy fighting off that virus, and it makes you more susceptible to getting a bacterial infection. So what might start off as a viral infection can then change to become a bacterial infection. And that's why we tell families that once the fever is around for 4 or 5 days, which is usually what we would tend to see to suspect a bacterial infection, then we would want to check and see if there's any signs in the ears, in the throat, or in the chest to suggest that that might be what's going on.
So Laura, we've talked about respiratory illnesses and prevention and treatment. What are the things that you want parents and caregivers to know about how to take care of their kids during respiratory illness season?
So I think it starts with prevention. So that would include things like immunizations, getting the flu shot and the RSV immunizations when you're eligible. And then it goes to the good habits like washing your hands, not going to school or to parties when you're not feeling well or when you have a fever. And then it evolves into how can we manage the illness at home versus versus needing to go to see your doctor or go to the emergency department.
Thanks so much, Laura, for joining us on another edition of J-Talk and J-Talk Live. It's been great. You've offered some great advice for moms and dads and caregivers on how to take care of their little ones over this tough season. And we look forward to having you on again when we do another edition of J-Talk Live.